In the next step, we want to carefully strip visceral pericardium and remove the fat in some of the key areas so that we can examine the surface features, which will include the auricles, the various chambers of the heart, and especially the left and right coronary vessels. We want to look at their branches and the accompanying veins on those major vessels as well. If we look at the heart here, you can have some people in your team cleaning up in the thorax while somebody else starts to dissect away and clean up the heart. If you look at the visceral pericardium that's on here, it's not meant to allow muscle to be teased apart so that there's not as much friction. You can actually work underneath that very thin layer of pericardium and strip that off. Now, it's not so important that you clean it off in the muscular areas, but in these fatty areas where you can see some vessels here and here. So to clean these up, get underneath that pericardium first, sort of like peeling the skin off of a grape. And then once you get under that pericardium and peel it back, now blunt dissection will allow you to clean up some of the fat in at least the key areas following the vessels so that you can see the veins and the arteries of the heart itself. So this is one technique to speed up your dissection and really present the vessels of the heart in their key areas. Another thing that will help you along your way is if you look under the auricles, that's where you're going to find the coronary arteries. So under the right auricle, like right here, pull that pericardium away, tease it with a blunt instrument, and there you can see, needing a little bit more cleaning still, the right coronary artery coming into view, following it all the way back to the aorta. If we turn the heart slightly to the left side, where you see the much smaller left auricle, or called atrial appendage, and you dig underneath this one, you'll find the circumflex branch. Dig all the way back under the auricle, and you follow that circumflex branch, and it will reveal for you the left coronary. Now, the left coronary artery is actually very, very short, right here. It's only that long from the aorta until it branches into a circumflex branch, and the branch that comes down the anterior wall, which is going to be the anterior interventricular, or clinically known as the LAD. So after a little bit more cleaning of this, we'll come back and we'll see all these vessels in the review. So we've cleaned the heart up by stripping some of the pericardial visceral layer in some key areas, and now we've been able to reveal some of the features that you'll want to see. Here we have it standing on its apex, essentially, and there we have the pulmonary trunk. That's going to lead to the right ventricle. Here's the aorta. That's going to lead to the left ventricle. And notice how they're separated in this ventricular septum with the major vessel. That's the left anterior descending branch of the left coronary artery. If we follow it up, here you can see the left auricle, the smaller of the two auricles. If you lift that and we rotate, now you can see from the aorta the branch, which is very short, of the left coronary artery, which will branch into the left anterior descending or left anterior interventricular. And here we have the left circumflex branch, which hides underneath the left auricle. That will then come around to the obtuse marginal branch. If we rotate to the right, here you can see the pulmonary trunk going down to the right ventricle. There's the interventricular septum with the LAD in it. Now we're going to pull this little fat piece out of the way. We're going to look in and see the aorta again, and here is the right auricle. We flip that up. Now you can see the right coronary artery with this first branch coming up as the SA nodal branch, and then it's going to come around in this fat-filled space, and it's dropping down at this point. If we rotate a little bit further, you can see it giving off an acute marginal branch. Then it's going to head posteriorly as we stand it up a little bit. This is diaphragmatic surface right here. And as it comes around into the atrioventricular groove now, it's going to drop into the interventricular groove as the posterior interventricular artery. Maybe we can zoom in on that little piece right there a little bit more. Right in there, good. So now you can see the right coronary dropping into the interventricular space or sulcus as the posterior interventricular, and look at the large vein with it. This is going to be the coronary sinus, middle cardiac vein, and the small cardiac vein. So those are the major vessels that you should be able to find by cleaning up some of the strategically located fat pockets that will be on your heart. First, in this step, we'll open a U-shaped flap in the right atrium, clean and identify the inflow and outflow areas and the major internal features of the right atrium. Here's an example of how you would open that up. Orient the heart by looking at the superior and inferior vena cava, and then do a U-shaped structure from the auricle towards the vena cava. Leave the vena cavas intact. Let's look at the features of the right atrium. For the purposes of demonstration, we've opened it up a little bit broader than you will in the dissection. For orientation, up here you can see the superior vena cava. That's going to be one of the inflows. Then we have inflow from the inferior vena cava, located down here, coming up and through. And then we're going to have inflow from the coronary sinus, which also has a valve associated with it so that the blood coming in from the inferior vena cava doesn't push back through the coronary sinus and stop venous return from the heart. We open up this auricle, spin it around, and you can see a little flap right here. That's the valve of the inferior vena cava or the coronary sinus. And if you drop in through that, there's a hole right here. That's the ostia of the coronary sinus. And that's going to go around, and you can see the forceps are inside the coronary sinus, which sits in the atrioventricular sulcus posteriorly. The next thing we're going to look at is the outflow. To open that up, we see all the way down through, and here you can see the cusps of the tricuspid valve. Right here's a cusp, and here's a cusp, and then a little septocusp right here. That's the tricuspid valve. We'll pull back out a little bit. Now, the embryonic remnants are going to be the foramen ovale. To find that, blood would shoot straight up through the inferior vena cava and shoot towards the interatrial wall. When we open up the interatrial wall, we can see a beautifully formed fossa ovalis, a little depression that's circular in shape. Above it, we can see a thickened component, which is known as the limbus ovalis. Finally, we'll look at the auricular appendage, which has been cut to show this opening. But you can see that there are smooth-walled portions of the atria, and there are unsmooth portions. The unsmooth portions has little bars of muscle in it, which are known as the pectinate muscles. And pectinate muscles are the muscle in the atrial appendages only. Of course, the right atrial appendage is larger, and they tend to be the biggest of them. If you come back to the smooth component, where the pectinate muscles end, that's called crista terminalis. And the crista terminalis leads all the way up towards the superior vena cava, and right at the edge of those is where the SA node is located. Now that we've seen all of the components of the right atrium, let's move on to the right ventricle.